vlog. I am Dr. Joydev. I am a consultant pathologist and general physician. In this channel, I usually describe all the health related topics in a simplified way so that it is easier for you to understand. And today's topic is albendazole. Albendazole is one of the commonly used anti-helminthic or anti-parasite medication. That means it helps to kill the worms that lives within our body. So what is the mechanism of action of this anti-helminthic drug? This drug actually it limits the supply of glucose to the parasite, and with the absence of glucose, these parasites they usually do not survive. By that way it can kill the parasites within our body. Now let us talk about some of the side effects of this medication. First of all, this is one of the safest medication, and it is usually given for a short period of time. When it is given for a longer period, then only we can see some of the side effects. And among the side effects, the most common ones are vomiting, pain abdomen. These are the common side effects. And when it is given for a longer duration, then we can experience two features. One is marrow suppression, that is characterized by drop in hemoglobin or total leukocyte count or platelet count, and the other one that is deranged liver function. So if it is given for longer duration, then we have to keep in mind that two things can happen. First one is marrow suppression. It is rarely seen, but still there is a chance. So we have to check the blood counts in a regular interval. Also, if it is given for a longer duration, then we have to look for if there is any liver function abnormality or not. So we have to do some liver function test in a regular interval. Now today in this vlog I'll be talking about some of the measures by which we can prevent this worm infection. The most important among them, that is your hygiene. If you wash your hand with soap and water before every meal, then there is very less chance of contamination by this organism. Also, after toilet you have to wash your hand. This can also prevent the transmission of that organism. If you are having some fruits, then you should be cautious and you should wash these foods carefully before eating. If you are taking some foods which were prepared long ago, then you are having this, then before taking that food you have to rewarm that food before eating. Also, you have to maintain all the hygiene measures. And also one thing you have to keep in mind, that whenever you are eating some kind of meat, you make sure that that one is well cooked. If you are having some raw meat or any kind of half cooked food, then there is chance of contamination of some kind of worms. So by this way you can prevent the contamination of worms. Now there are few questions, few commonly asked questions about this drug. The first one, how does it work? I have already discussed that it limits the supply of glucose to these worms, and they do not survive without any glucose. Now the next question, that is in case of pregnancy, or someone is willing to become pregnant, should this medication should be taken or not? So during pregnancy, or someone is preparing to be pregnant, then this medicine this medicine should not be taken, because this medicine can cause some kind of harm to the fetus. So it should always be avoided during pregnancy or in the preconception phase. Now, how long this medication should be taken? This medication should be taken as prescribed by your doctor. It should not be discontinued whenever you are feeling better. You should continue the medication for the time that your doctor has prescribed. Now, is there any effect on the blood count? Yes, if it is given for a longer duration, then the blood count might fall. So whenever it is used, in some case of hydatid cyst or neurocysticercosis, these are the two conditions when this medication is prescribed for longer duration, then only this type of adverse reaction can occur. And there are only two adverse reactions that occurs in case of longer use of this medication. The first one, that is there is drop in the counts, that means marrow suppression, that is characterized by low hemoglobin, low platelet count, low WBC count, and another one, that is deranged liver function. So if it is given for a longer duration, we have to follow, or we have to check the blood counts and liver function test in a regular interval to make sure that there is no such side effects. Is there any risk of infection whenever we are taking this medication? Yes, there is slight decrease in the level of immunity whenever you are taking this for a longer duration. So you have to be cautious whenever you are taking this medication for longer duration. You have to be cautious, so that you cannot so that you are not getting any kind of infection. So you have to follow all the hygiene measures, and by that way you can prevent any infection. And also, this medication is used in various conditions, in various doses or schedule. It is usually used in neurocysticercosis from 8 to 30 days, and in case of hydatid cyst, it is used usually for 28 days, and after that there is a 14 days gap, and again you have to repeat for another 28 days, and like this you can continue for 3 cycles in case of hydatid cysts. In case of normal common worms, this medication is used for 2 to 3 days with a single dose per day. So in this blog, I have discussed about albendazole, one commonly used anti-helminthic or anti-parasite medication. If you are new to my channel, then don't forget to subscribe to my channel. And if you feel that this might be informative to some other, then you don't hesitate to share this in any kind of social media. And also, if you find this video informative and helpful, then don't forget to give us a like. Till then, take care and stay fit, be healthy. Thank you.